Good morning. Thank you so much for joining us. We'll get right to the question. What is it like to live with severe asthma?
Thank you so much for asking that question. There are about 200 million people in the world that have asthma, and about 10% of those people have severe asthma. And guess what? Those patients are actually the patients that utilize the most services because they have the most unpredictable symptoms. Besides wheezing, coughing, reaching for that inhaler all the time, patients are now no longer going to activities. They are struggling walking their dog. They're struggling doing their laundry. And these patients really are suffering quite a bit. Not only that, but they're utilizing a lot of healthcare resources. They're going to the ER, they're having unscheduled visits with their doctors, and in between, they're not feeling great. So I do encourage patients to really think about whether they've accommodated their life into this new normal of less breathing, less comfortability with their lungs and these activities, and think about whether or not they could be eligible for new treatments and maybe a reassessment of their asthma.
What causes severe asthma?
Severe asthma mostly is caused by an underlying inflammation. It's called type 2 inflammation. This is the kind of inflammation that you think about in terms of allergic diseases. But it's not just allergic diseases that cause type 2 inflammation. We can have that initially triggered by pollutants. We can have that initially triggered by viruses and other infections. And then this cascade of kind of abnormal, dysregulated inflammation occurs in the lungs, and it becomes a chronic health condition. It doesn't just go away. And so patients do need to persist in terms of taking a treatment. And it can be, of course, with severe asthmatics, difficult to treat. So really it's rooted in this type of abnormal inflammation that now has become a chronic condition.
What are the treatment options for people living with severe asthma?
Patients with severe asthma oftentimes will have multiple therapies in order to control and prevent flare-ups. They, of course, have baseline, regular maintenance medications, which they should take daily. They have also rescue medications in case they get a flare-up. Sometimes there are even pills, sometimes there are inhalers. Oftentimes, though, with severe asthmatics, it's just not enough, and they end up having to go to the ER or their doctor and get something called systemic corticosteroids, which, of course, long-term is not super favorable for them to have multiple doses of that due to its potential adverse side effects. So the newer treatments are a class of medications called biologic medications. In the past 10 years, this has really arisen as precise targeted treatment for patients, so to treat that specific type of inflammation called the type 2 inflammation in their lungs. One of the newer medications, which is now this year FDA approved, the first and only ultra long-acting biological medications as an add-on treatment for severe asthma, is called Extensor. What's exciting about this medication is that it's just 2 doses a year. I think that helps with patients who consider, maybe they're afraid of multiple injections, et cetera. So this being a ultra-long-acting biologic is 2 doses a year. It is by GSK, who I'm here on behalf of, and you do have to remember that there may be some potential side effects, some of which can be serious and life-threatening, such as allergic reactions, called anaphylaxis, and certain infections. So I do encourage patients to speak to their doctor about the standard treatments that they have, as well as biological treatments and perhaps this new Extensor, if it's appropriate for them.
Is there anything else you would like our audience to know about?
I think that the most important thing is to really consider whether or not their life has changed and has it become an asthma problem that is now uncontrolled. And so if that's the case and they're finding that they are struggling to breathe, using systemic corticosteroids, going to the ER, going to unscheduled visits with their doctor, that perhaps it's time to revisit and see if some new therapeutics could be potentially available to them and if it would be appropriate for them.
Thank you so much. I appreciate your time. Have a great day.
Thank you. You too.
Bye-bye.
Thank you.